This is an article critique on the effect of biofeedback accompanying occupational therapy and functional electrical stimulation in hemiplegic patients. The investigators of this study are Maria Inez Paez Laurenchao, Lina Mara Rizzo Batistea, Cristina May Moran de Brito, Cristina Rodriguez Tsukimoto, and Margarita Harumi Miyazaki. This is a randomized controlled trial with two groups, one receiving the biofeedback interventions and the other receiving treatment as usual. This study did receive level 2 evidence due to the fact that it has less than 100 participants.
The objective of this study was to evaluate the effect of surface electromyographic biofeedback when used in conjunction with occupational therapy and functional electrical stimulation has on spasticity, range of motion, and upper extremity function in hemiplegic patients. 59 ischemic cardiovascular stroke patients were included in the study. 31 were put into the intervention group, and 28 were put into the treatment as usual group. Both groups received 1-hour OT sessions twice a week. Functional electrical stimulation was used on the elbow and wrist extensor muscles for both groups. The intervention group received an additional 1 hour of the biofeedback intervention once a week. Outcomes of interest include manual dexterity, hand function, elbow and wrist range of motion, elbow and wrist spasticity. The FIM was also used to determine the patient's independence in everyday activities. Statistically significant differences between groups were found in terms of hand function, wrist range of motion, and the patient's ability to perform the peg placement. No significant differences were found for the groups in manual dexterity, elbow range of motion, elbow spasticity, and wrist spasticity. It should be noted that although these findings were not statistically significant, there were statistically significant in-group improvements throughout the study. The authors concluded that a combination of biofeedback, OT, and functional electrical stimulation improved overall range of motion and upper extremity function. There were clinically significant reductions in spasticity as well.
Strengths of this study include the length of the study, which took place over the course of a year. Parameters are set out so it is easily replicated in any intervention you want to use it with. And also, the use of functional assessments improves the validity of this study. Limitations include the small study population, which consists of 59 participants. It's not generalizable to the stroke population because it was taking place in one outpatient facility in Brazil, so it can't be generalized to the rest of the population. And you're not able to quantify the compensatory movements that they found were reduced with patients who received the biofeedback therapy. Occupational therapy's focus with stroke patients is regaining functional use of the upper extremity. This study found that stroke patients who received occupational therapy in conjunction with biofeedback had significant improvements in upper extremity function. This included improved hand function and upper extremity range of motion, as well as a reduction in wrist and elbow spasticity. The study also found that clients who received biofeedback showed decreased use of compensatory strategies to complete ADLs. Biofeedback also is a simple and painless treatment option with no severe side effects, making it a great use in practice. The study stated that patients could see movement within their arm, which encouraged them to work hard to gain the strength to perform activities independently.